Hello and welcome to Getting Your Money's Worth, the show that focuses on value. I'm Judith West, and our guest today is Erik Goldman, a medical journalist and editor-in-chief of Holistic Primary Care. Okay, hi. Thanks for being on the show, Erik.
Thanks for having me.
We're going to discuss holistic medicine and other suggestions you might have, but we have to start out with the immediate. What's the state of the healthcare today?
Well, train wreck is one description I've heard pretty recently. Disaster, big mess.
Accident.
I mean, take your pick.
Take your pick. Not, in a word, not good.
Not good. It's not happy. Nobody's happy. Doctors aren't happy. Patients aren't happy. Families aren't happy. The big corporations who are paying for a lot of people's health care are not happy. Until recently, the only people who seemed to be happy were the heads of insurance companies, and even they're not so happy. And same with the drug companies; they were doing pretty well for a while, but the whole thing seems to be tottering. Honestly,
it's a tsunami.
It's another good description.
So tell me, we now have a president-elect, and President-elect Obama. I mean, a big piece of his platform is health care. What do you think of his plan?
Well,
at least as it has been articulated.
As it has been articulated, a couple of things. I think the general impulse to want to try and improve health care is a really good one and an absolutely necessary one. Where I take issue with it, and my comments hold true for the McCain plan or any of the other plans that have been floating around Washington, is that they are all focused on how to increase insurance coverage, how to get more people covered under health insurance.
Universal health care.
Well, no, but what they're talking about is universal health care insurance.
Okay.
And I think people really need to understand that that's very, very different from actual health care. Just because you have insurance doesn't mean you get care or the care that you need.
Right.
And as has been somewhat demonstrated in Massachusetts, where Mitt Romney a couple of years ago did push through a bill for universal health care insurance in Massachusetts, it did increase the number of people in that state that have insurance. But the wait times to see a doctor have now doubled. In some places, you've got to wait for 3 to 6 months even to see a primary care doctor because there's not enough doctors. Doctors don't want to work there. They're overworked. They're overwhelmed. So just increasing the number of people in the insurance system is not going to change healthcare. And I think the more important question before we ask ourselves how we're going to finance more healthcare is what kind of healthcare do people really need? And I feel like none of the plans that I've heard really ask that question. It's all about how do we fund more of what we've had, and I don't think what we've had has really worked.
Right. Well, you know, the truth of the matter is we spend more than ever. A huge part of our budget, federal budget, is taken up by health care services, and I believe that we spend more per capita than many other developed countries, but we have not seen a reduction in cancer, in heart disease, and some of these other diseases. I read someplace that 70% of our medical doctors' dollars go to covering something like 5 different diseases.
Yeah, I think that's true. I've heard that.
So tell me something then. You've been doing this for a living. You talk to doctors. You write about doctors. Where should we be going? What should we be doing?
Well, a couple of things. I think one thing we really need to focus on is real preventive medicine. Now, when you hear the pundits and the policymakers and the insurance companies talk about preventive medicines, they say, oh yeah, well, we cover mammograms and we get kids vaccinations and all of that. Okay, well and good. But mammograms really aren't preventive medicine. Mammograms are early detection of disease, just like all those other cancer screening tools.
Right.
Why is it that people who want nutrition counseling so they can figure out how to get their diets back on track can't get that paid for by insurance?
Yeah, or
fitness trainers, dietary supplements, because there is evidence for a lot of dietary supplement, the benefits of some of these supplements. Not everything, but a lot more than people think. And that stuff's not covered by insurance. basic self-care or preventive maintenance care like chiropractic, acupuncture, all of those things, they may be covered for some things. Like if you have a back injury, you can get some acupuncture, you can get some chiropractic, but not as basic preventive maintenance. And I wonder why not.
Well, you know, what's happened in this, you know, we're in the enlightened 21st century, it was the last half of the 20th. What's happened that all of a sudden people can't figure out how to eat properly without getting nutrition counseling? They can't figure out what to do to keep themselves in shape without going to a gym. Have we become lazy, slovenly, and fast food eaters?
Well,
is that?
Yes, but it's a deeper question. I mean, I think as a country, as a nation, we've gotten more sedentary. Most of us are not out working with our bodies all day. We have gotten very mentally lazy in some regards, but I don't think that's really the nut of it. What's really at work here is go into a grocery store, walk around, look at how much processed food is being marketed to us in a very sophisticated manner. I mean, a lot of this stuff is very unhealthy, but it's being marketed, including to little kids. I mean, there's a reason they put the cereal down at the lower,
That's right.
you know, so the kids can see the goodies and they
Right.
want it and they beg for it, and it's all
snacks.
sugar and corn syrup and it's not good for them.
Right.
We're eating things that, from an evolutionary point of view, we were never designed to eat. You know,
Right.
we weren't meant to eat trans fats or hydrogenated oils or
Corn syrup.
corn syrup or any of these processing ingredients.
Right.
And a lot of processed foods, what they do in processing them is take out all the nutrients. So you get stuff, you get calories, but all it does is really increase your weight, but it doesn't really give you nutrients.
Are we getting to what you're talking about, holistic?
You mean is the tide moving that way? I would say so. Certainly,
First,
we're not there yet.
Let's define it. What is holistic care? What is holistic medicine?
Okay, it means different things to different people. I'll tell you what it means to me. And
well, you're editor-in-chief of a magazine, and that's your logo. So
right.
what does it mean?
Okay, to me, it has to do with how you look at a particular problem in health or illness.
For example,
the issue is: are you looking at the parts? Body parts, the cells, or are you looking at how those different things are related to one another? Traditionally in our medicine in Europe and America, what we call allopathic medicine, which is mainstream medicine, they look at the parts. So you have a separate doctor for every organ system.
Right.
And the idea is, well, if there's a disease in that part, the dysfunction must be in that part, and we have to treat that part. In reality, all the parts of the body, all the systems of the organism are interconnected. They communicate with each other biochemically, they communicate through the nervous system, they communicate energetically. So some of the older medical systems like Chinese medicine or Ayurveda, which are in a way the roots of holistic medicine, look at how the systems are interrelated.
So should we go back to the idea we used to have a general practitioner? You went to one doctor and he took care of you.
I think it's very important for general practitioners to be able to make a healthy living. Honestly, I do.
Can they anymore?
It's getting tougher.
Is there such a thing anymore?
It's getting much more difficult for them. It's tough out there in primary care. It's particularly tough if you want to practice holistic medicine because most of those services aren't covered by insurance. So they have to figure out how to operate outside of the insurance industry, which for a lot of doctors is very difficult, especially if they're mid-career and they've been in the insurance industry for a while.
And also there is this kind of boutique medicine where people can elect to pay, but the truth of the matter is, if people are paying already for insurance, they don't want to pay. They don't initially pay to go to the doctors.
Right. It's an
I mean,
issue.
it used to be, you brought up the point about insurance. Insurance really traditionally is an umbrella that people have to cover the expenses that their normal everyday money can't cover, like major medical or major major flood, major storms. But now the thinking is that if every little visit, every little pill
should be
rebated.
That's right. And so what that's done is created a strange incentive system where when pharmaceutical companies or device companies come out with a new device, the first thing they do once they get approval from the FDA is go to the insurance plans and Medicare and Medicaid and try and get them, convince them, cajole them, however they have to do it, to get those devices or products into the formularies of the managed care plans so that doctors can prescribe them and they can be covered by insurance.
And also there's this incentive to test and over-test and test every little, coupled with our own litigious society, and to every little complaint, it requires an MRI.
Yeah, and it's created some very perverse incentives economically, which is why we have the system we do. I don't think it started out maliciously. I think it was, you know, if you go back to the roots of the insurance industry, which was back in the 40s, what happened was after World War II, there was a wage freeze. They were trying to rebalance the economy and get everybody back to work. So some companies figured out that a good way to attract the best and the brightest was to offer this perk called health insurance. Now, think about the 40s. We didn't have MRIs and bone marrow transplants and all these other very high-tech things. The population was a lot younger.
I was like, we didn't have people living into their 90s.
Not many of them, not like we have now. So everything was cheaper, and I don't think anybody expected it was going to get as out of hand as it did.
And it's gotten very out of hand.
Yeah.
The cost of, you know, common drugs in hospitals, aspirins and things like that. You know, there's all kinds of war stories about what medical care costs. So we're at this crossroads here. What are we going to do? What can we do? What can we do about what can the individual do about it, Eric? Forget. I mean, forget government.
Right? Because it's got the changes have to happen.
Somehow it has to happen at the grassroots level. What can the individual do?
Well, I think you have to first of all really think about your own diet and lifestyle. And it doesn't, I'm not a diet food faddist or, you know, an extremist in any way. Food should be enjoyable and it should be pleasurable. Eating is one of the joys of life, being with friends and family and enjoying meals.
So staying fit.
But staying fit and really thinking about what you eat, think about where it comes from, think about what goes into it. Try to eat get as much fresh produce and good fats. You know, I'm talking about omega-3 fatty acids, fish, and things like that into your diet. But even minimize the bad stuff.
And also, even with the insurance, I mean, you know, the show's getting your money's worth. So just because it's a third-party manager paying my medical bills or my hospital bills, it doesn't keep me from looking at it. And if I see gross inequities or foolish things, asking the doctor. But you know, there used to be a thing that you couldn't discuss money with doctors.
Right.
Like that's a no-no.
Right.
But why not?
Well, you should be able to. Unfortunately, because of how the system has run for the last 30 years, many doctors don't even know how much their charges are. They really don't.
And people
they never
don't,
see the billing.
And many people don't even know how much they're getting out of it or what it's costing.
That's right.
They have no interest in even finding out what it costs them to go to the doctor.
Right. And then bear in mind that the insurance industry itself is making a heap of money off the whole system until, I mean, this last year it's kind of downturned a little bit, but up until then, they were making record profits. Well, I mean, we've been talking about this healthcare crisis for 20 years.
And this holistic medicine, or this alternative form of medicine, it is more economical.
It can be.
Can it be?
I think the numbers...
We don't have much time. Do you believe in organic food?
I do believe in organic food, absolutely.
Even if it costs more money?
I think it's worth it.
Worth it, yeah.
Absolutely. Back to this question, because I think it is an important one.
In a few seconds.
Our intuition is that it would save money. I believe it does in the long run. In the short run, you know, good natural products are expensive. Good herbal medicines are expensive.
Well, everything we know about maintaining a house or maintaining the land, everything we know about most things commodities that we own, tells us that preventive care pays.
That's right.
So is there any reason to think it wouldn't work for the body?
That's my point.
Right.
Exactly.
Okay. Thanks for being on the show.
Very good. Well, thanks for having me.
Thanks, Erik Goldman. I'm Judith West. You're watching Getting Your Money's Worth. We have Erik Goldman, who tells us to practice some good old-fashioned advice in taking care of ourselves. Thanks for watching.